I want you to stop whatever you're doing right now and really listen to me, because what I'm about to share with you could genuinely be the most important 4 minutes. No, the most important conversation you have today. Not about your diet, not about your medications, about something you do every single night, in the dark, completely unaware of what your body is quietly going through. I need you to hear me on this. Your bedroom, the place you've spent a third of your entire life, may be silently working against you. And I don't say that to frighten you. I say it because I've sat across from too many families in waiting rooms who never saw it coming. Because the person they loved felt perfectly fine at dinner. They laughed, they watched their show, they said goodnight, and they went to bed the same way they always did. And somewhere between midnight and 5 o'clock in the morning, something went terribly wrong. Here's a number I want you to remember. Nearly half, close to 47%. Of all fatal cardiovascular events in adults over 60 happen during the nighttime window between 10 p.m. and 6 a.m., not during exercise, not during stress at work, during sleep, the very time your body is supposed to be healing itself. And the cruel irony? Many of those events are connected not to underlying disease alone, but to something as simple and invisible as the position a person was lying in when it happened. This is the part most doctors don't explain. We talk about cholesterol. We talk about blood pressure medications. We talk about diet and stress management. But almost nobody sits down with an older patient and says, "Let me tell you about the nighttime minefield you're walking through every single night." So today, that's exactly what I'm going to do. I'm Dr. Clarence Martin, and I've spent over 2 decades working specifically with adults over 60. I believe, with everything in my clinical experience, that how you sleep is just as important as how you eat or how much you exercise. Your sleeping position affects your blood pressure, your brain's ability to clear waste, your oxygen levels, your heart's workload, and the health of your spine and nerves. All of it. Every night. Here's why this matters so much more as we get older. The aging cardiovascular system is less elastic. The walls of your blood vessels, a layer called the endothelium, which is basically the inner lining that keeps everything smooth and flexible, becomes stiffer, less responsive. Think of it like a garden hose that's been left out in the sun for 20 years. Young and flexible. Water flows freely. Old and brittle. Any kink, any twist, any pressure, and the flow is compromised. In people over 60, a bad sleeping position can increase the risk of stroke and accelerate memory loss by over 60%. That's not a small number. That's not a statistical footnote. That is a life-changing, life-ending risk hiding inside a habit that most people have never once questioned. So let's start with the worst. The stomach sleeper. If you sleep on your stomach, I need you to really hear what I'm about to say. Stomach sleeping is, without question, the most aging position for your spine, and it's quietly devastating for your heart's oxygen supply. Here's what happens. When you lie face down, your head has nowhere to go but hard to one side. Think about holding your neck twisted at a 45 to 90 degree angle for 6, 7, 8 hours. No one would do that consciously. But millions of people do it unconsciously every single night. That sustained rotation compresses the vertebral arteries, the blood vessels running through the sides of your neck, and reduces cerebral blood flow. Blood flow to your brain. We're not talking about a pinch you feel immediately. We're talking about a subtle, sustained restriction that, over months and years, contributes to cognitive decline, morning headaches, and in vulnerable seniors, raises the risk of a transient ischemic attack, what people call a mini-stroke. But the damage doesn't stop at the neck. When you're flat on your stomach, your heart has to work against gravity to pump blood to your brain while simultaneously dealing with the compression of your chest against the mattress. Your lungs can't fully expand. Every breath you take is slightly shallower than it should be. Night after night, your body is running on less oxygen than it deserves. Think of it this way. Imagine trying to breathe through a straw that someone has their finger partially over. You can still breathe, but you're working harder for less air. Now imagine doing that for 8 hours, 365 nights a year, after the age of 65. Your heart is doing overtime every single night. The fetal curl. Now let me talk about something that feels incredibly comforting and is, unfortunately, a trap. The fetal curl. Knees pulled up tight toward the chest, spine rounded, chin tilted down. So many people sleep this way because it feels safe. It feels warm. It feels like protection. But here's what's actually happening inside your body. When you pull your knees tightly to your chest, you compress your diaphragm, the large dome-shaped muscle directly beneath your lungs that is responsible for driving every breath you take. Compression of the diaphragm forces shallow breathing. Your oxygen saturation drops, and when oxygen saturation drops during sleep, your heart rate can become irregular, your blood pressure fluctuates, and your brain, which is the most oxygen-hungry organ in your body, begins to suffer quietly. I think of Eleanor, a 68-year-old retired school teacher who came to see me after months of waking up exhausted, regardless of how early she went to bed. She was sleeping 8, sometimes 9 hours, and still dragging herself through the day with brain fog and a heaviness in her chest that she couldn't explain. She'd been to her GP, had her blood work done, and everything looked fine on paper. But when I asked her to describe exactly how she slept, she curled herself up right there in the chair, knees pulled up, arms tucked in, spine curved like a question mark. What she was experiencing was the cumulative effect of months of diaphragmatic compression. Her body was essentially quietly suffocating its own oxygen supply every single night. Her heart was straining not because of structural disease, but because of a posture she'd adopted without thinking. We changed her sleeping position, added a body pillow for support, and within 3 weeks she came back into my office and said, "Dr. Martin, I feel like I've woken up for the first time in a year." The soldier position. Now let's talk about sleeping flat on your back with your arms at your sides, what I call the soldier position. And this one surprises people, because lying flat on your back sounds like the neutral, safe choice. For some people, in some circumstances, it can be. But for a large percentage of seniors, and this is critical, it is anything but safe. Here's the physics. When you lie flat on your back, gravity pulls the soft tissues at the back of your throat, including the base of your tongue, downward and backward. In a young, toned person with good muscle tone, this is a minor inconvenience. In an older adult, especially one with any excess weight around the neck, decreased muscle tone from natural aging, or even just the natural relaxation of sleep, this collapse of soft tissue can partially or fully obstruct the airway. This is the physical mechanism behind obstructive sleep apnea, and I need you to understand what sleep apnea actually does to a cardiovascular system. Every time your airway closes during the night, even for 10 seconds, your blood oxygen plummets, your heart lurches into an alarm response, your blood pressure spikes dramatically, and your body floods itself with stress hormones like cortisol and adrenaline. Studies have shown that uncontrolled sleep apnea triples the risk of heart attack. Triples it. And in seniors already managing hypertension or arterial stiffness, those repeated overnight spikes can cause lasting damage to the walls of the arteries and dramatically increase stroke risk. There's something else that happens with flat back sleeping that most people, and honestly, many clinicians, overlook. Silent reflux. When you lie completely flat, the acid in your stomach has a much easier time traveling up the esophagus. You might not feel the burn, hence the word silent, but that acid is making contact with the delicate lining of your throat and, in some cases, can be quietly aspirated into the airway. This causes chronic nighttime inflammation that disrupts sleep quality without you ever waking up. The recliner chair trap. I want to talk to those of you who have migrated at some point from your bed to your recliner. Maybe it started because of back pain. Maybe because of snoring. Maybe the recliner just felt more comfortable. And I understand, Becky, I'm not here to judge, but I need you to understand what that chair is slowly doing to your body. Sleeping in a semi-sitting recliner position, particularly below a 45-degree angle, forces your lower body into a V shape that puts persistent pressure on the backs of your thighs and the area behind your knees. This compresses the major veins responsible for returning blood from your legs back to your heart. When that venous return is restricted night after night, blood pools in the lower legs. It thickens, it slows. And in that slow, thick, pooled blood, the conditions for deep vein thrombosis, what people call DVT, or blood clots in the legs, become ideal. I think of Dorothy, a 79-year-old woman whose daughter brought her in because of persistent swelling in both ankles that had worsened over 6 months. Dorothy had been sleeping in her recliner for nearly 2 years, initially for comfort following a back procedure. What had started as a temporary solution had become a nightly routine. Her recliner, which she loved dearly, was quietly shutting down her circulatory health. The swollen ankles were the warning sign. We caught it before a clot formed and traveled. But I've seen cases where we weren't that fortunate. If you wake up most mornings with swollen ankles, tingling in the legs, or a heaviness in the calves, please speak with your doctor about this. The alignment saver, left side sleeping. Now let's talk about what works. And this is the part I genuinely love, because the news here is good. The single most heart-protective sleeping position for adults over 60 is supported side sleeping on the left side. I call it the alignment saver. Here's the science behind why the left side specifically is superior. Your heart sits slightly to the left of center in your chest. When you sleep on your left side, the natural anatomy of your cardiovascular system is working with gravity rather than against it. The aorta, your body's largest artery, which carries oxygenated blood from your heart to the rest of your body, curves naturally to the left. Side sleeping on the left allows blood to move through that arch more efficiently. The inferior vena cava, the large vein that returns blood from your lower body to your heart, runs along the right side of your spine, and lying on your left side takes direct compression pressure off it, allowing freer return of blood to the heart. Left side sleeping also places your stomach below your esophagus, using gravity as your ally in keeping stomach acid exactly where it belongs. If you deal with heartburn, acid reflux, or have been told you have GERD, gastroesophageal reflux disease, left side sleeping can significantly reduce nighttime symptoms without a single additional medication. Now here's the key. Left side sleeping only works optimally when it's properly supported. The most common mistake people make is sleeping on their side without a pillow between their knees. This is important. When you sleep on your side without knee support, your top leg falls forward and your pelvis rotates with it. That rotation creates uneven pressure on your lower spine and hip joints. And over time, that adds up to morning pain, hip inflammation, and disrupted sleep. A firm pillow or a purpose-designed knee pillow placed between your knees keeps your pelvis neutral, your spine aligned, and your body in true recovery mode all night long. The elevated back sleeper. For those of you who simply cannot sleep on your side, perhaps due to shoulder pain, hip replacements, or other conditions, the elevated back sleeper is your best alternative to lying completely flat. The principle here is straightforward. By elevating your upper body to approximately 30 degrees using either a wedge pillow or an adjustable bed base, you recruit gravity as a protective force rather than an enemy. At this angle, the soft tissues in your throat are no longer collapsing directly backward. The airway stays more naturally open, reducing snoring and sleep apnea episodes. Your acid reflux is kept at bay, and perhaps most importantly, your heart's workload is reduced. When your upper body is slightly elevated, the return of venous blood from your lower body to your heart becomes easier, less uphill work for your cardiovascular system. I think of Linda, a 73-year-old patient of mine who came in with a constellation of problems: disrupted sleep, morning headaches, fatigue, and worsening blood pressure readings in the early morning hours. Her cardiologist had actually recommended she try sleeping at an incline, but she hadn't taken it seriously until the symptoms became impossible to ignore. She invested in a quality wedge pillow, elevated at exactly 30 degrees, paired with a knee pillow to prevent sliding. Within 6 weeks, her morning blood pressure readings had dropped measurably. She was sleeping through the night for the first time in years. She told me, "I didn't know a pillow could do what a pill couldn't." That's not magic. That's anatomy working correctly. The starfish position, nature's reset button. Let me describe a position that works beautifully for certain periods of the night, what I call the starfish position. This is sleeping on your back with your arms gently extended slightly out to the sides, rather than pinned rigidly at your body. Think of it as nature's reset button for your upper body. When your arms are trapped at your sides or tucked beneath you, you create pressure points along the ulnar nerve, the nerve that runs along the inner side of your arm from your shoulder down to your pinky finger. Compressed overnight, this contributes to the pins and needles sensation and arm numbness that many seniors experience upon waking. By allowing the arms to rest in a slightly open position, you decompress these nerve pathways, allow better blood circulation through the shoulder joints, and give your spine a more natural resting position. The starfish is not ideal as your primary sleeping position if you struggle with apnea, but as a resting posture during lighter phases of sleep. When you're not in deep sleep and are naturally more likely to shift positions, it provides real structural relief. The true senior sweet spot, the 45-degree side recline. Now I want to share with you what I genuinely consider to be the gold standard sleeping posture for adults over 60. I call it the true senior sweet spot. It sounds complex, but it isn't. It's a 45-degree side recline, and once you try it properly set up, you will not go back. Here's what you need. A firm wedge pillow that elevates your upper body to approximately 45 degrees. Not 30, not 60, but 45. Then you position yourself onto your left side on top of this wedge so that your body is simultaneously elevated and side-angled. Your upper body is lifted, keeping the airway open and preventing reflux. Your left side orientation promotes optimal heart blood flow and gastric positioning. And your final piece? A knee pillow between your legs to maintain pelvic alignment. This combination does something remarkable. It delivers every benefit we've discussed: airway protection, cardiac efficiency, reflux prevention, spinal alignment, simultaneously. But there's one more benefit I haven't mentioned yet, and it is perhaps the most compelling for anyone concerned about long-term brain health. This posture optimally supports what scientists call the glymphatic system. Think of it this way. Your brain doesn't have a lymphatic system the way the rest of your body does. Instead, during sleep, particularly on your side, cerebral spinal fluid pumps through channels in the brain, physically flushing out metabolic waste products. Among those waste products is beta amyloid, the protein fragment most strongly associated with the development of Alzheimer's disease. Side sleeping, and particularly this elevated side recline, dramatically improves what researchers call lymphatic drainage of the brain. You are, quite literally, clearing toxins from your brain while you sleep. That is not a metaphor. That is documented neuroscience. And it only happens optimally when you're in the right position. The heart-safe environment. Now, I want to step back from the mattress for a moment and talk about the environment surrounding your sleep, because even perfect positioning can be undermined by a hostile bedroom environment. Temperature first. There is what I call the Harvard rule for sleep temperature. Your room should be between 18 and 22 degrees Celsius. That's 65 to 70 degrees Fahrenheit. Here's why this matters specifically for cardiovascular health. When your bedroom is too cold, particularly below 65 degrees Fahrenheit, your blood vessels constrict in response to the temperature. Your arteries tighten, and a heart that already manages arterial stiffness from aging now has to pump against cold, constricted, resistant arteries all night long. Blood pressure rises, heart strain increases. Many of the cardiac events that occur in the pre-dawn hours are linked, in part, to temperature-induced vasoconstriction. This is particularly dangerous between 4 and 6 a.m. when the body's natural cortisol surge is already nudging blood pressure upward in preparation for waking. Don't make the heart fight on two fronts. Keep that room temperature in the safe zone. Now, light. I need you to pay close attention to this one, because it is criminally underappreciated. Many seniors keep a nightlight in the bedroom or hallway for safety, completely understandable. But if that nightlight emits white or blue spectrum light, it is silently disrupting your cardiovascular health. Blue and white light, even at low intensities, suppresses melatonin production and activates your retinal light-sensing cells in a way that signals to your brain, it is daytime, stay alert. This suppression of melatonin has been linked not just to disrupted sleep cycles, but to measurably higher insulin resistance, elevated fasting blood sugar, and increased nighttime heart rate. Studies have shown that sleeping in even dim light versus total darkness is associated with higher rates of hypertension in older adults. The fix? Swap to red or amber spectrum nightlights. They provide the safety illumination you need without activating the blue light neurological alarm system. The 3-step evening countdown. Let me give you 3 concrete steps to build into your evening routine starting tonight. The first is your light dinner rule. Aim to have your last meal, a light one built around lean protein and non-starchy vegetables, by 7 p.m. Here's why timing matters so much. Digestion is an energy-intensive, blood flow-intensive process. Your digestive organs need a significant increase in blood supply to process a meal. When you eat late and then lie down, your body is locked in a digestive tug-of-war. Competing blood flow demands between your gut and your heart. For a senior with any degree of coronary artery narrowing, that competition is not trivial. A light, early dinner allows digestion to complete substantially before you sleep, so your cardiovascular system can focus entirely on cardiac recovery and brain restoration during the night. The second step is your hydration window. Drink 1 glass of water, about 250 milliliters, 1 to 2 hours before bed. Not right before bed, because that will send you to the bathroom at 2 a.m., which creates its own risks. The reason timing matters here is blood viscosity, the thickness of your blood. During sleep, you lose water through respiration and subtle perspiration. Blood that becomes even slightly dehydrated becomes thicker, more sluggish, and more prone to clotting. The overnight hours are when clot formation risk is naturally highest. Hydrating appropriately in the evening hours keeps your blood flowing smoothly, reduces clotting risk, and supports that critical glymphatic brain cleansing process we talked about. The third step, and this one I want every single one of you to memorize, is what I call the 3-stage stand-up protocol, for those moments when you wake in the night and need to get up. This is important. When you've been lying down for several hours, the blood in your body has redistributed toward your core. Your leg vessels are in a state of relative pooling. When you stand up suddenly, particularly if you're over 70 or on blood pressure medications, your cardiovascular system can fail to compensate quickly enough. Blood pressure drops suddenly, the room spins, you reach for something, you fall. This is orthostatic hypotension, and it is one of the leading causes of nighttime falls and fractures in seniors. Here's the 3 stages. First, while still lying down, move your feet and legs. Flex your ankles, bend your knees, activate the leg muscles to push blood back toward your heart. Take 10 seconds. Second, sit up slowly and stay seated on the edge of the bed for a full 5 seconds. Let your blood pressure equilibrate. Don't rush. Third, then and only then, stand up, holding something stable if needed. This 3-stage process takes less than 15 seconds and could prevent a catastrophic fall. Your body listens while you sleep. I want to close with something I say to every patient I truly care about. Aging does not have to mean declining. I know that message gets lost sometimes under the weight of diagnosis and medication lists and specialist appointments. I know it can feel like your body is slowly becoming your adversary. But I want you to hear me say this clearly. Your body is not working against you. Even now, even tonight, it is working extraordinarily hard on your behalf. Every night you sleep, your heart beats 30,000 to 40,000 times without you asking it to. Your brain quietly clears the debris of the day. Your immune system rebuilds. Your muscles repair. Your hormones reset. Your body is doing all of this for you. What I'm asking you to do, what we've talked about today, is simply to make that nightly work a little easier. Give your heart the angle it needs. Give your brain the drainage it deserves. Give your airway the space it requires. These are not radical interventions. They are simple, dignified adjustments that honor the extraordinary machine you've been living in for 60, 70, 80 years or more. Tonight is not just another night. Tonight is the first night of a different kind of rest. A more protective, more healing, more intentional rest. Start with the left side position. Get that knee pillow. Bring your room temperature into the safe zone. Eat your dinner by 7. Drink your glass of water. And if you wake up tonight, remember your 3 stages before you stand. Your body has earned a good night's sleep. And now you know how to give it one. I'm Dr. Clarence Martin. Stay healthy, stay safe, and give your body the rest it has earned.